I'm Michael P. Coleman, Content Director for Brother Be Well. I want to welcome you to the platform today. Today, we're going to be talking about a pretty important topic here. We're going to be talking about COVID and healthcare workers getting insights about the realities that those frontline healthcare workers face as they battle this global pandemic. I'm sitting down today with Aron King. He's a registered nurse, and he's the secretary of the Capital City Black Nurses Association. Aron, welcome to Brother Be Well.
Hi, well, thank you.
Great to see you. Great to see you again. Let's jump right in here, man. I feel like this show is really checking in with you and your colleagues. I'm wondering first what your initial reaction was to the news of the global coronavirus pandemic, and how did your colleagues react? We all got it. You know, the news was just a barrage of information. How did it hit you guys when you first heard about it?
So when all the news first broke about COVID-19, I think it was just kind of let's just see what this is all about kind of moment. I've had experiences in my career with like other epidemics such as like Zika and Ebola, and the epidemic's a little bit different. It's more when you have cases of a certain outbreak in a specific geographical area versus a pandemic, which is more of a global impact. So I had no experience with pandemics. So with epidemics like Zika, there's always like some education and some training, and we kind of come up with a plan just in case it kind of touched down in our area. But we never really see it. Like Ebola wasn't something I experienced in my hospital. So it was just kind of a wait and see kind of thing. And as the numbers started to go up and we start to see patients, then we're like, oh, wait, this might be something a little bit bigger. So it became kind of just a little bit of a little scary.
Wow, yeah, I could imagine. It was scary even for me, and I wasn't in the middle of that, obviously. One of the things that kind of frightened me, frankly, was hearing about the lack of PPE, personal protective equipment that was available or was reported to have been available. I'm wondering what that landscape was like in the hospital from a viewer's perspective, watching the media report. It seemed to be evolving and quite dynamic and changing every hour. Different pieces of information were coming out. What was it like for you right in the middle of that when information is changing minute to minute and hour to hour?
I think it's always important to understand that the virus is novel. They call it the novel COVID-19 virus. And what that means is it's very new. And so everyone is learning at the same time. And so one of the things that happened was protocols changed almost daily, sometimes a couple times a day, as we begin to learn more. And the difference between the East Coast and the West Coast was very different. The East Coast got hit like very hard, specifically New York. In the West Coast, we did have a spike in some areas like metropolitan areas such as Los Angeles, who even now they have more cases than some states in the US. So it's just kind of trying to learn how to use our PPE and how to conserve. There was our different lines of transport. So even if the stocks that you would purchase online or through places that carried them were becoming very low as the need was going up, and then even being able to get them shipped, all that was delayed. And so there's a lot of worry here and there, especially when you have so much knowledge from New York and how they were hit so hard and their shortage of PPE. It just created a big fear in the hospital and a lot of hospitals in California.
Wow, facing that fear, and this is true not just of nurses, but all frontline workers, but certainly nurses have to be incredibly resilient in order to even survive, let alone be successful in your job. But I would think even with that resilience, it had to be hard to predict, as you just said, that intelligence, if you will, for lack of a better term, changes all the time. The ravages of that pandemic had to be hard to predict. I just should have maybe asked this question right at the top. How are you guys doing? How is everybody doing that's facing that 8, 10, 12 hours a day, 5, 6 days a week? How are you guys?
I think overall, I think the nursing, and I can only speak from the nursing point of view, but I know that doctors and other specialty areas like respiratory therapists who specifically deal with a lot of these patients because this is a respiratory virus. We're just overall very tired. We had a nice break like over the summer where our numbers kind of dwindled down, but we were all expecting that to change, right? And so Halloween was kind of like that first big time where people were going to try to get together and do things. It was like the first holiday where we anticipated. that there was going to be an up spike in cases, and that had to do also with weather. But we have sicker patients. We worry about a lot of the same things that everyone else worries about. You worry about your family, things like that. And so overall, I think it's just this overall just we're tired. That's all I could put it
Tired.
at.
Yeah, if I could get together, I'd give you a hug, give you a pat on the back. I know you guys have to be tired, man. I can't imagine. Let's talk about being tired, or specifically compassion fatigue versus caregiver burnout. Let's talk about it. They have similar symptoms. Compassion fatigue is considered a preoccupation of absorbing trauma with emotional stresses of others, and that can create a secondary traumatic stress in the person that's doing the caregiving. Burnout's about just being worn out. We all have experienced that. It can span across a variety of industries, and it's particularly significant, I would think, with doctors and nurses. How are you and your colleagues experiencing one or both? Are you guys experiencing both compassion fatigue and burnout, one or the other, or a little bit of both?
I think where I work on a medical surgical unit, and I'm in leadership on that floor. So overall, we do get some burnout. There's a lot of nurses that work longer hours. They stay over to help. They work extra shifts, and so that kind of contributes to this burnout. And just dealing with the whole emotion of the patients are a lot sicker. At our level, we're fortunate enough to see patients that get better. They do have longer stays in the hospital, but many times they get better and they're able to go home. Um, Talking to my coworkers in my previous job when I worked in the intensive care unit, they're really experiencing that compassion fatigue and burnout. Oftentimes, when you have the diagnosis of COVID in the hospital, you're not allowed to have visitors. The patients that are seen in the ICU are sicker. They don't always get better, and they have these long times on the ventilator. And often you're the point person for family members. And so they want to know, how's it going? Are they getting better? And when there's really nothing to say that your
Mm.
family members, your family member that's in the hospital is getting better, or they're getting worse, it's really hard to have that conversation with people over the phone. Those kind of conversations we talk about in the life, a lot of those need to happen in person. It's very difficult and it's very trying on a nurse to have those conversations over the phone.
I could imagine it's so hard to such personal conversations where that personal touch, I would think, can make the difference. I've never worked in that field, for a reason. I barely made it out of high school biology, so I was as far away from studying nursing as you could imagine. But I can't imagine, the need to have that personal connection and then not being able to do it's just really hard.